doctor is taking a lot of care and following all the COVID protocol, helping everybody else, to follow it.
But certainly, that's what is more important, because people's safety is
very,
always
very
the concern for everybody, and that certainly should be taken care, whether it's a human side or animal side.
Yes. So because health of not only pets but also the doctor's health, veterinary health, the pet parents' health, everybody's life is at stake. So we cannot be careless at any point of time. A single careless, and then that will cause a problem to everybody. So we
and what about the surgeries? How they are being managed? Like in a day, you are having one, because in normal routine days it is like 3, 4, 5 surgeries. But then how it is now? It's,
as far as possible, no routine surgeries we are avoiding.
Okay.
See, because routine surgeries will also require a lot of things like manpower and all these supplies.
Yeah.
So what happens is we are now rationing our supplies also, so that we use it for patients which really require it.
Yeah.
So routine elective surgeries which can be done sometimes later, we request the pet owner that do it. See, because if you consider, say, spaying we can do it after 2 months also, but say pyometra, I can't say come after 2 months. So emergencies are emergencies, we are treating emergencies, but elective surgeries, as far as possible, we are telling people that we can keep it for some other day, so that whatever limited resources are there, we can use it for patients which require them. We have to be very calculated now to select patients, do surgery.
Yes. So shall we start? Because the number is increasing, so we'll just start with the webinar, so that when the people who have already joined, we should not make them keep them waiting. So we'll just start. Okay. So good evening to one and all. Welcome to the webinar by Vetina Healthcare on the occasion of World Veterinary Day. We are grateful to this noble profession of being veterinarian. In 2001, the World Veterinary Association established that there will be a World Veterinary Day celebrated on the last Saturday of April. World Veterinary Day aims to promote the veterinary profession and work. The theme of this World Veterinary Day focus on improvement of the animal and human welfare, the environment, food safety, and practices of animal transport. This year's theme is veterinarians' response to the COVID-19 crisis. According to the World Veterinary Association, the continuing COVID-19 pandemic has changed life as we know it and significantly affected the global health and human population, as well as the animal populations. And yet, we veterinarians displayed the ability to cope, adjust, and adapt. Eventually, all efforts resulted in the meaningful and rapid evolvement of veterinary medical science. Today, we will focus on recent advances in the diagnosis and treatment of arthritis in pets. To share the expertise on this topic today, we are pleased to have Dr.S.V. Vishwasrao. He is a gold medalist of Bombay Veterinary College. He has completed M.V.Sc and Ph.D. in surgery from Bombay Veterinary College. He worked as teaching faculty in Mumbai for 23 years. He has been awarded Best Teachers Award by Bombay Veterinary College and Maharashtra Animal Sciences University. He has also been awarded gold medal at national level for his work in surgery and radiology. At present, he is a full-time practicing small animal surgeon at Bandra, West Mumbai since last 33 years. We welcome Dr. Vishwasrao.
Thank you, Dr. Siva.
Welcome, sir.
So should I start with my webinar, please?
Yes.
Sure.
Yes, sir.
So good evening, everyone. Am I audible? Okay.
Yes, sir, you are audible. Yes. Just a slideshow.
Okay, I'm doing that. Just give me one moment, please.
Yes.
Okay. Is it okay? Should I start now?
Yes, sir.
Okay. So topic of my webinar is recent advancement in diagnosis and treatment of arthritis in pets. Before I start, today is the World Veterinary Day. I wish all my veterinary colleagues a life full of energy, enthusiasm, strength, and support from the Almighty to serve the animal kingdom. Friends, the present COVID pandemic has proved that since viruses are jumping from animals to humans, the veterinarians now will be in the forefront in combating such diseases and serving animals and human beings. Veterinarians will have a very, very important role in future. So to begin with, arthritis is basically an inflammation of the joint. See, this term is often used when there is any stiffness which involves pain or stiffness of the musculoskeletal system. Per se, arthritis is not a single disease, but actually it's a group of several diseases which cause pain and limit movement of the joint. You'll be surprised, and also, you would know that approximately if you see every 5 patients in your clinic, one of them has arthritis. It's a slow, progressive disease, and the initiating events are obscure. So who is the first person to see this? Actually, the pet parents observe something at home. They make a preliminary diagnosis that something is not well with my dog. They may observe pain, while the dog is walking, or they might observe the dog is limping, or a particular limb is stiff when it is running, when it is walking, when it is jumping, or even morning when it gets up, it feels, oh, my pet is having some problem, or it's sitting in an abnormal position. So the history taking and observations of the pet parent are very important for diagnosis of arthritis in pets. When we think of arthritis, we always feel that arthritis will occur in old dogs. Yes, it's right. Arthritis is very common in old dogs, but even when a small puppy comes to you for a first consultation or for vaccination, examine it thoroughly, because the way it sits in your clinic, the way it walks, the way it gets up, it's very important that you might find very subtle signs of arthritis, which you should tell the owner that this dog later on could have a problem, especially of the musculoskeletal system. Now, breeds that are predisposed to osteochondrosis, dysplasia, say for example, Labrador retrievers, Bernese mountain dogs, Rottweilers. We see hip dysplasia very common in dogs, Labradors, which come to our clinic. If small breeds are coming to your clinic, say like Chihuahua or Shih Tzus, you will find patella luxations very common. So these breeds which have these conditions, pre-existing conditions, they are prone to arthritis, which is secondary to these underlying conditions. Free roaming dogs also do have arthritis. Suppose there is a traumatic injury on the bone, the alignment of the joint gets deviated. Such dogs will also develop arthritis, which increase the chances of arthritis. Even dogs which are overweight, working dogs, security dogs, you'll find arthritis is common in these dogs also because of wear and tear of the joints. One more thing which we have observed is arthritis is very common in dogs which have a very rapid weight gain early in life, which also have a very high calorie intake in early childhood, in early puppyhood, as compared to dogs which have restricted feeding. So if you find pups growing very fast at an early stage, they are on a very high calorie diet, there is likely that they may develop arthritis at a later stage. So what are the signs of arthritis? Most important, remember, signs of arthritis are intermittent lameness. Intermittent means one day you will see a lameness, one day you may not see. Okay. Stiffness of the joints, stiffness of the limb. Mostly early morning when they get up, they limp. That is after a prolonged period of rest. If you touch the joint, it is warm and tender. There are certain signs which we don't relate to arthritis, but are actually signs of arthritis. You might pet sleeping for a more time, more than usual. And exercise intolerance you will see. When a dog stands, it stands in an abnormal posture, or when it walks, it has an abnormal gait. So these are the signs which we need to pick up that these are signs of arthritis. So joint pain is referred to as arthralgia. When a single joint is involved, it's called as monoarthritis. When 2 or more joints involved, it is oligoarthritis. When 4 or more joints involved, it's polyarthritis. So arthritis varies. The type of arthritis may vary from simple wear and tear of the cartilage to an arthritis where all the joints of the body are involved, rheumatoid arthritis. So you have different grades of arthritis. So what is clinically characterized by? Most important is you will find there's limitation of movement, effusions, and local inflammation of the joint. Now, when an arthritic patient comes to you and you palpate the joint, extend and flex it, you will hear a small crepitus. You can feel a small crepitus clinically in the joint. If you manipulate the joint, that is extend and flex the joint, you will find that the range of motions is affected. And if you palpate the surrounding tissue, you will find soreness of the joint. So these are small things which you need to note down before you make a diagnosis of arthritis. So what is it biochemically characterized by? Biochemically, arthritis is characterized by reduction in the proteoglycan concentration, which is present in the cartilage. So what happens when proteoglycan concentration decreases? The water content of the cartilage increases. So the synovia, which is viscous, which is slimy, becomes more watery. If you ever do a pathological examination of a dog who had arthritis, what you find in the cartilages, there is irregular wear and tear of the articular cartilages. You'll also find sclerosis of the subchondral bone, as well as new bony growths in the joint, along with inflammation of the synovia, inflammation of the synovial joint. Some pets are very mildly affected with arthritis. They may not even show that they have arthritis. Few limitations, say a little discomfort here and there, little limping here and there, that's okay. But pets that are more severely affected may be totally crippled. They can't even go out of the house, say to do urination or to passing of stools. So as I said, arthritis varies from very mild to very severe. You know, pets with arthritis, one peculiarity is there. Unless a joint is put to stress in early stage, symptoms are not seen. I'll give you an example. A family has a pet dog. Saturday, Sunday, they go out for a picnic. The dog is playing around, running around. Monday morning, the dog starts limping because the joint has been put to stress. So the same pet may show symptoms after a period of exercise or increased demands on the joint. Most important is signs of arthritis appear infrequently first. Someday we will see those signs, someday we will not. We'll find, oh, the dog has become all right. But as the disease progresses, the signs of arthritis, limping, lameness, pain becomes persistent with time. What does the owner see? The pet owner is also observing. He finds that there is asymmetrical lameness. When the dog walks, there's something funny in the dog. Also finds that there's a change in the normal behavior of the dog. See, this is very important. What is change in the normal behavior? Like the doorbell rings, the dog would go running to the door. Nowadays, it doesn't do that. He used to jump in on the sofa, he used to jump in the car. Nowadays, he doesn't do that. He keeps sleeping for a long time. That's very unusual. What he also observes is when he's walking with his dog, he finds on one particular limb, the dog doesn't bear weight. There's altered gait. And if this arthritis is secondary to hip dysplasia, both the coxofemoral joints are affected. There is shortness of the stride. The dog walks with a very short stride. The dog will show reluctant to even climb the stairs if the pet owner is staying on the first floor or the second floor. Or as I said, jumping into the car, jumping into the bed, jumping on the sofa. So these are the signs which are also seen by a very vigilant pet parent. Friends, whenever pets come to your clinic, you'll observe they will start smelling the floor, they will start smelling the furniture, they will start smelling the examination table, because pets by nature very inquisitive. They want to find out which dog has come here. Okay, so they will try to sniff. But an arthritic patient, when he comes to your clinic, he'll just park himself. He will just lie down on the floor. He's not interested in what is there in your clinic. Other very interesting thing of lameness is a pet may show lameness at home because the environment is familiar to him. When the same pet comes to your clinic, lameness may not be seen. This is very typical behavior of canines. They will try to hide their sickness in unfamiliar environment. So history taking from the owner and what happens from home, that history is very, very relevant. So what are the stages of arthritis? Stage 1, when only minor bone spurs begin to develop, and the cartilage, remember there is a cushioning cartilage between two bones. In two bones, if you see the synovial joint, there's a cartilage. So this cartilage begins to break down. That is stage 1. In stage 2 is also considered as a mild stage. In this, erosion of the bone starts and new bony growths start developing. There is a limitation now in the joint movement. The joint movement is limited to very less extent, but limitation is there. Stage 3 is considered as moderate. In this, the bones get affected. The cartilage thins out. That is the cushion between the bones goes where there is wear and tear, and the space between the two bones in the joint reduces. Stage 4, it's a final stage. It's considered to be very severe. In this stage, the joint space between the bone is reduced considerably. The cartilage is almost gone, and the joint mobility is greatly limited. It's limited to a great extent. Why? As a clinician, you must know these stages because early diagnosis of osteoarthritis is a key. See, because pets, once they are diagnosed with osteoarthritis, they have to live with it. As a veterinarian, we have to make their life comfortable, and we have to see that we should conserve the joint, whatever is left, to the best possible way. So once the pet owner has come to you or you have diagnosed that it looks like a case of arthritis, I would suggest my veterinary friends, before you take the dog on the examination table, see the dog walk outside your clinic in an open space. The walk of the dog will tell you a lot of things. Which leg is the problem? Which limb is the problem? Where the problem could be? How severe it is? Whether there are any compensatory mechanisms on the other limbs. Be careful. Don't make the dog run or trot, because running or trotting dog, it will mask the symptoms. So gently allow the dog to walk with the owner on a leash. So you have an idea of which limb is a problem, where the problem could be. Then you take the dog on the examination table. Start palpating the joints. What you might see is there's hypertrophy of the connective tissue around the joint. A crepitus. If you hold your palm on the joint and move the joint, you can feel the crepitus within the joint. That is because of the bones rubbing onto each other. The range of motion has reduced, and there is pain response. The pet will resist extending and flexing the joint because it's in pain. Goniometry, it's an instrument used for diagnosis of arthritis. It's a non-invasive tool. It's used to measure both flexion and extension. Simple. You have to place this tool over the fulcrum of the joint, move the joint, and measure the angle. I find this tool useful when we are treating a dog, when we want to see what is the result of a treatment, how much difference it has made in extension and flexion of the limb. See, when a particular joint is affected, what happens is it's a musculoskeletal system. So the other joints start making compensatory mechanisms. I'll give an example. Suppose you have a 30-40 kg Rottweiler. who has hip dysplasia. Now, because of hip dysplasia, he's got secondary osteoarthritis. The dog is heavy. The hind limbs cannot bear weight. So the weight gets to the forelimbs. When the weight gets shifted to the forelimbs, you'll find the chest muscles start developing because of weight transfer. So when such a pet comes to you, you will find atrophy of the thigh muscles At the same time, the front chest muscles have developed. So these are also signs which you need to look into. There are some pet owners, who have never observed that pet has arthritis. But if you take a radiograph and tell them that your pet has got arthritis, they'll say, but doctor, my pet has never shown any signs of arthritis. They're absolutely right. He's never showed signs of pain. They're absolutely right. That is because you must educate the owner. And I'll tell you why it is important. That pain in case of arthritis is chronic. Pain in case of arthritis is very dull. Now, why? Why we must educate the pet parent regarding these things? Because other signs which are associated with arthritis, say for example, when the doorbell rings, the dog doesn't run to the door, he doesn't jump into a car, he doesn't jump onto a sofa, or doesn't jump into a bed. These are signs, or he's sleeping for a long time. These signs, the owner has not correlated with arthritis. We as veterinarians know these are also signs of arthritis. So once you educate the owner regarding other signs of arthritis, you'll get a better feedback when you're treating a dog. Say, for example, when you start treatment for arthritis, you cannot cure arthritis, but you can alleviate pain. So the dog starts getting up on its own. The dog starts trying to jump. So these signs tell you, oh, Dr. after you have started with the treatment, there's been improvement in this. So educating the owner regarding signs of arthritis and other signs of arthritis will help you get a feedback of your treatment. So what are the laboratory examinations you'll do? You can take out synovial fluid. Remember, it has to be done under sedation or general anesthesia, extremely aseptically. You can collect the synovial fluid, examine for WBC count, okay, examine for clarity, viscosity, okay, cell. So this will give you a lot of clue. Other things you can do is a mucin clot test. It's important. Synovial fluid is very viscous. Okay. So if you hold the synovial fluid, which you have removed from the joint, in between glove fingers, and then you separate these fingers, it forms a string. The normal synovial fluid is viscous and sticky. So it forms a string, say about 2.5 to 5 centimeters. If it's an arthritic dog, the water content of the synovial fluid increases. So viscosity decreases. So when you do this, when you do the same test, you'll find that the string gets broken between 1 to 2 centimeters. Because it's more watery, it's not slimy, it's no longer sticky because of arthritis, because of increase in water content of the joint. Diagnosis. Radiography is the best tool. Of course, radiography can give you a diagnosis of arthritis at a slightly later stage because bone changes need to develop. But what you can see, if you take a good radiograph, you can see there is increase in fluid content of the joint. What you can also see is periarticular osteophytes, new bony growths along the joint. Subchondral bone sclerosis you can see. And there is narrowing of the joint spaces. Now remember, when we talk of narrowing of joint spaces, make this very clear. When we talk about arthritis in pets and arthritis in human beings, there is some differences are there. We must know, because if your pet parent is a human doctor, he will ask you, about the joint spaces, all this. In human beings, when they suspect arthritis of the knee joint, so they will take a standing radiograph, standing anterior posterior AP radiograph of the knee joint. What we do in pets, we put them on the table, lateral recumbency, and then take a radiograph. Maybe one of the assistant is holding the leg also. So actually space between the joint in veterinary practice becomes slightly insignificant. If you have a modern digital radiograph or a computerized radiography unit, you can magnify the joint images and have a better look at the joint space. What also you will see is periarticular osteophytes, subchondral bone sclerosis, and bone remodeling. Now, if you look at this radiograph, what you see, both the coxofemoral joints, both the hip joints are showing arthritis. This is secondary to hip dysplasia. Now, if you see, the femoral head and the neck has become one. Okay, there is remodeling. There is narrowing of joint space. Okay, and this is not a weight-bearing radiograph. This is a radiograph of a dog who's in the supine position. Okay, with the limbs extended. Okay, CT scan, computed tomography. Though it is not used always, it's not necessary to use it always because it's an expensive tool. But then when do you use this? Yes, CT is useful, especially when there is a fragmented coronoid process of the elbow. Some dogs perpetually limp with the front leg. You take a radiograph, you can't make out anything. Do a CT scan and you realize that there's a fragmentation of the coronoid process of the elbow. So CT scan does help in some cases, though it's a slightly expensive procedure. MRI. MRI is an excellent tool for diagnosis, though we don't use it very often and not required in routine practice for arthritis. Best of MRI, the best part of MRI is it can detect very small changes in the cartilage. Early changes, early arthritis can be picked up by an MRI because you can see the cartilage very, very easily. Scintigraphy is a tool. You inject a radioactive dye into the body and then see with the gamma camera. You will find there is areas of increased metabolic activity around the joint. So once you have diagnosed arthritis, that this particular pet has arthritis, so what is the aim of your treatment? There are two major abnormalities in arthritis. One is loss in function and other is pain. As a veterinarian, I'll tell you, you treat pain. Elevation of pain must be the primary goal and restoration of function secondary. Why? Because once pain goes away, there is partial restoration of function. So treat pain, function will gradually come back. So treatment plan. What is the treatment plan? We have various treatment plans. There are three major components: conservative, medical, and surgical therapy. Conservative. Exercise and physical therapy does help. It will help to improve the pain scores, disability scores, and actually the patient starts really feeling well. So small, regular, limited physical activity is very good for arthritic patients. When you diagnose arthritis, the pet parent will ask you, doctor, should I take my dog out for a walk? Yes, please do. Short, small walks at the pace of the dog. If he wants to walk slowly, let him walk slowly. But yes, he shouldn't be sitting whole day because the more he rests, the more it's going to aggravate. So regular, limited physical exercise is very important. One thing you must remember, whatever treatment you do for arthritis, weight management is very important, because if the dog keeps on putting on weight because of arthritis, your entire treatment gets null and void. So weight management, control of the dog's weight is very important point to be considered while treating arthritis. Medical treatment consists of non-steroidal anti-inflammatory drugs. This is the mainstay. So what do we do? We treat them with non-steroidal anti-inflammatory drug because they are both anti-inflammatory and analgesic. But be very careful when you're using NSAIDs. You have to see that the pet doesn't have any pre-existing renal disease and is neither hypovolemic. Corticosteroids also have been used. Many of my teachers are there today as participants. We have seen them using corticosteroids wonderfully. But now we know that though corticosteroids are anti-inflammatory, analgesic, antipyretic activity, long-term use is not good. So we can use them to a limited extent. We can use them in some cases, yes. But we know that long-term corticosteroids in pets will have their own systemic side effects. So you can use this non-steroidal anti-inflammatory drugs, say like carprofen, etodolac, aspirin, phenylbutazone. But as I said, limit the use of NSAIDs, watch for kidney values, and see that the patient is not hypovolemic. There are certain structure modifying osteoarthritic drugs. They are defined as agents which reverse, retard, and even stabilize the underlying osteoarthritis. See, they have a pharmacological ability because they will support the anabolic activity and reduce the catabolic activity within the joint. Most importantly, what is observed in these drugs is they help to increase the blood flow, the subchondral blood vessels which are there within the cartilage. So repair of the cartilage is faster, especially in an arthritic joint. So what are these drugs? Pentosan polysulfate sodium. It's an anti-inflammatory. It's an osteoarthritis disease modifier. What does it do? It stimulates hyaluronic acid synthesis. Pentosan also has fibrinolytic properties. It increases the synovial blood flow. Please remember, this molecule is very similar to heparin. So it has an effect on blood coagulation in the body. So if you are planning a surgery on the pet, you have to use this Pentosan polysulfate sodium extremely, extremely carefully, or discontinue it for some time because it will cause bleeding. So what is the dose? 3 milligrams per kg intramuscular subcut at a week's interval, 5 to 7 days interval. So give it once in 1 week, see how the effect is, repeat the next week, see how the effect is, again give it next week. So your clinical observations are very important. How is the drug working? So clinical efficacy is the primary monitoring parameter for Pentosan polysulfate sodium. Intra-articular injections. Remember, to give an intra-articular injection in dogs, you need to sedate a dog. At times, you need to anesthetize the dog. Extremely aseptic precautions. Okay, you need to take intra-articular betamethasone and triamcinolone has been tried with mixed results. At moderate concentration, even methylprednisolone has shown to reduce inflammatory activity. So this also you can try. It's good, but do it very, very carefully, aseptically, under sedation and anesthesia. The other medications which have been tried for arthritis is gabapentin, 3 milligrams per kg orally once a day. So your aim of the treatment is, see, arthritis is something which a pet has to live with. Okay, it's a manageable disease. We tell the pet parent it's not a curable disease, it's a manageable disease. So there will be some days which are good, there'll be some days which are bad. Aim of my treatment that good days must outnumber the bad days. So that is the aim of my treatment. So you have slow acting disease modifying osteoarthritic agents. What these group of drugs do, these are chondroprotective agents. They protect the cartilage, and that is why they are called as slow acting disease modifying osteoarthritic agents. They support the chondrocyte matrix, hyaluronate synthesis, and they inhibit the degradative enzymes. The degradative enzymes which are produced in the joint, they reduce them. So what are these? Glucosamine and chondroitin sulfate. Remember, as the body ages, the production of glucosamine slows down. Therefore, it is very important to supplement the body with glucosamine to have good health in the joint. We know there are different types of glucosamine, but glucosamine sulfate is more effective because sulfate is needed to produce the cartilage and repair the cartilage. So glucosamine sulfate is more effective as compared to other salts of glucosamine. Chondroitin sulfate, you'll always find glucosamine and chondroitin sulfate, they are always together. Chondroitin sulfate helps in the repair of the damaged connective tissue which is there in the joint. It helps to keep the joint hydrated and prevents cartilage breaks down, even protects the cartilage. As far as chondroitin sulfate is concerned, if you have a low molecular weight chondroitin sulfate, it's quickly absorbed from the intestine. Now, why do we use glucosamine and chondroitin sulfate? See, because if you use them, you're going to reduce the dose of NSAIDs. That is the best effect. So your dependence on NSAIDs will reduce. So the side effects will reduce. So that is why chondroitin sulfate, glucosamine has to be a part of the treatment of arthritis. Purified glucosamine and chondroitin sulfate, as I said, these are essential components of the matrix. They maintain the elasticity and flexibility of the joint. So if you supplement this in arthritic patients over a period of time, yes, you definitely see a difference, a change. What are the other agents, disease modifying agents require? Manganese, it's a cofactor in biosynthesis. Ascorbate is used for linking collagen molecules. Vitamin E is a part of the treatment. It limits the formation of free radicals and pain within the joint. Hyaluronone, it's an elastic polymer. It lubricates the joint and acts as a shock absorber within the joint. So all these are very essential components of your arthritic therapy. Physical therapy is extremely good. The aim of the physical therapy is to, as far as possible, correct deformities, control pain, to strengthen the weakened joints, strengthen also the muscles which are around the joint. So it helps to improve the function of the limb. So proper exercise, proper limited exercise can actually diminish pain. You must always be careful when you're exercising a patient, because each patient's tolerance levels is different because of other conditions. So you need to really work out of how much exercise this patient can do. There should be a good balance of rest and exercise. You can apply heat, you can apply warmth. It will help to increase the blood circulation. It'll promote relaxation and also relieve pain. Acupuncture has been tried for arthritis with good results. Actually, we as veterinarians feel putting needles inside a dog would be extremely painful. But there are vets who are doing acupuncture for arthritis, and they definitely claim that in fact it's a very relaxing procedure for these pets, and they really enjoy it. So acupuncture can also be tried for, of course, a person knowing acupuncture should do it, and this also gives results in arthritis. Massage, passive massage is very important. If you can involve the pet parent in it, because if you show the pet parent how to gently massage the dog, especially the limbs, especially the extend and flex the joint to prevent muscle atrophy, the pet parent feels involvement in the line of treatment. So you can show in your clinic how to do it gently, so the pet parent can do it every day, and you get better results. You have some vets doing cold laser therapy for pain management in dogs. It also works. It is also treatment that is suggested for osteoarthritis in pets. Surgery. Arthritis is a diffuse disease, so it does not lend itself to surgery. But sometimes, when medical treatment fails and non-surgical treatment options don't resolve, so there's plenty of discomfort and the patient is in terrible discomfort, then we think of surgery. So what we need to correct the underlying defect by joint replacement. So what is done is canine total hip replacement surgery is done. The entire joint is removed and replaced with a steel joint. Of course, it has to be done by a very experienced orthopedic surgeon, very calculated way it has to be done, taking into consideration all the factors, risk, complications, etc. Because if it is done properly, then it works wonders. So, but it has to be in the hands of good experienced orthopedic surgeons who are doing these types of surgeries. Many of the vets for arthritis nowadays do femoral head osteectomy. It's a surgical procedure to remove the femoral head along with the neck. It's basically done to alleviate pain. Basically, it's a salvage procedure reserved for conditions when because of pain medication also, if the joint is not responding, then femoral head osteectomy is done. My experience is that FHO works for patients which have a lower body weight, say less than 17 kg body weight. If the body weight increases more than 17 kg, if it's more than 17 kg, then definitely long-term results may not be very good if the dog, because of the dog's weight. So below 17 kg, it really works well. Arthrodesis is actually completely removing a motion of a joint by fusion of the opposing surfaces of the bone. It's also known as artificial ankylosis. It's an artificial ossification of the joint between two bones. Actually, this surgery is done very rarely. If the pain cannot be managed with medications, then artificial ankylosis is introduced in the joint. Arthroscopy is a very good procedure. A small pinhole is made in the joint. Of course, this is under general anesthesia, aseptic conditions, everything. And what is done is, once the joint is opened up through this arthroscope, the joint is lavaged with fluids. It itself gives relief to a patient. Sometimes, if with an arthroscope, if we are able to see small particles of small fragments of cartilage, we can remove them, and it gives a lot of relief to the patient. Abrasion arthroplasty is also one of the procedure. It's basically an arthroscopic procedure in which it's basically used when in arthritis is localized to a particular place. So what is done is bleeding is caused in the we stimulate bleeding within the joint, so that our aim is to form a fibrocartilage. Okay, this is only used in exceptional conditions when in a particular joint the arthritis is localized. What are the other strategies used for arthritis in pets? If you give well padded bedding for your pet, you'll find he's very comfortable. He or the pet is very comfortable, and this also prevents formation of bed sores. Two, if you are using a rubber mat or a padded non-skid flooring, you'll find it's easier for the pet to walk rather than on a smooth tiles. Gentle slopes, ramps, if you have, they are very easy to negotiate as compared to steps. So these are small things which you can advise the owner to do if it's possible, so that the comfort level of the pet increases. New techniques which are coming is articular cartilage paste grafting. It's a single step arthroscopic procedure in which pet's own cartilage and bone marrow stems are harvested, made into a paste, and then used to repair the damaged cartilage. This is called as mosaic-plasty. Other procedure is tissue engineering. Is a new area of biomedicine. It's used in the treatment of arthritis. The patient's own living cells are used to control and direct cell functions. So in this tissue engineering, what is now they're trying to find out is what are the signals which are required to stimulate the chondrocytes of the patient itself. So if we know those signals and we are able to stimulate chondrocytes within the joint itself, the cartilage will grow and the severity of arthritis will reduce. So to end, I would say what Maharishi Sushruta, the father of surgery, has said thousands of years ago. He said, and it's very relevant, very true for arthritis. We can cure it sometimes. We need to treat very often. But remember, comfort always. Make your patient as comfortable as possible. That this is the human side of the treatment of arthritis in pets. I thank you all for your attention. I thank you all for your time. I thank you, Vetina, for this opportunity, this wonderful opportunity you gave me on this World Veterinary Day. Thank you so much.
Thank you so much, sir. Thank you for this wonderful presentation. It was very informative for all our participants. There are many participants who have said thank you for this informative and very nice lecture by Dr. Vishwasrao. They are thanking you a lot. And with this, we will move ahead with, before we have our question and answer session with Dr. Vishwasrao, we will have a small quiz. On the occasion of the World Veterinary Day, we have arranged a small quiz for all our vets. So to begin with, my first question today is, what is the theme of this year's World Veterinary Day? What is the theme of this year's World Veterinary Day? You can just answer it in chat or in the question and answer box. It will be good if you put it in the chat box. So I give you 2 minutes to everyone. What is the theme of this year's World Veterinary Day? Waiting, vets in COVID, yes. Yes, role of vets in management of COVID, yes. Yes. There are many people who have answered that vets
Very
response
nice.
to COVID-19. Yes, yes, this is the correct answer. Thank you so much, everyone. Now, another question. It's a very easy one as well as a very interesting one. What is the largest known animal on earth? Everyone knows this, but still, let's see. Whale, yes, yes. Blue whale, yes. Many of them have answered blue whale. Yes, thank you so much. Yes. So the answer is blue whale. Yes, correct. Many of them are answering blue whale. Yes. One more question.
Somebody has responded elephant here.
Yes, elephant, but it is not the largest. It's a large animal, but it's not the largest.
Yes.
Yeah, you're right.
Largest, it is not the largest.
That's right. Yeah.
So the third question is, what is the slowest animal in the world? Slowest animal. No, not the snail. Yes. Yes, sloth. Yes. Many have answered it as sloth. It is not the snail, but the sloth. Yes. Yes, yes. The answer is sloth. Sorry, it's not turtle. It is the sloth. Thank you. Thank you so much for this overwhelming response to the question and for this quiz. So for the another questions, we will take a break. We will have a small presentation of product Pentorse, and then we'll have the question and answer session with Dr. Vishwasrao. So to begin with, I'll be sharing my screen now. Is it visible?
Yes, it's visible.
Yeah. So good evening, everyone, and a very happy World Veterinary Day to all the veterinarians across the world and in India. And we will see small details about our product, which is Pentorse. Pentorse 100, it's an injectable for canines. As you all know, it is for osteoarthritis. So what is Pentorse? Now, Pentorse is an active ingredient called the pentose and polysulfate sodium. It is a semi-synthetic and polysulfated polysaccharide. Pentorse 100 canine injection aids in the treatment of non-infectious inflammatory joints, non-infectious inflammatory joint disease in dogs, particularly in dogs. Many of our vets are also using it in cats, but it is specifically, we recommend it for dogs. This is derived from a plant source called the beechwood. PPS is most commonly used as an oral formulation to treat interstitial cystitis in humans and as an injectable drug to treat osteoarthritis in animals. See, there are many vets who have used it in cats for cystitis, and they have got wonderful results also. So this can also be tried. If you're getting good results with that, it can be used in cystitis cases in cats also, because some of our vets have already done and they have shared their experience with us. Now the dose for the PPS is 3 mg per kg body weight, that is 1 ml per 33 kg body weight. It is to be given subcutaneously every 5 to 7 days. Like once in a week, it can be given for 4 consecutive weeks. And then it can be repeated after a gap of 1 month. Give a rest of 1 month, can be repeated again 4 doses, gap of 1 month, again 4 doses, and again after 6 months of gap, like after the 3 courses, a gap of 6 months has to be given. And then depending on the progress of the condition, it can be continued further next year. Okay. Now, it has anti-inflammatory, anti-arthritic, and chondroprotective properties. It is classified under the disease-modifying osteoarthritic drug. Now, what is the mechanism of action? It inhibits proteolytic enzymes and decreases the loss of proteoglycans. It inhibits destructive enzymes like interleukin-1, interleukin-6, TNF-alpha. Then it also breaks down blood clots and increases the blood flow to the joints. This already Dr. Vishwasrao has also shared in his presentation. PPS increases the hyaluronic acid concentration in the synovial fluid, thus maintaining the viscosity of the synovial fluid. Then it initiates chondrocyte regeneration. Thus, this is the mechanism of action of Pentorse 100. Now, what are the indications? This drug can be used in osteoarthritic and traumatic joint disease, osteochondrosis dissecans, degenerative cartilaginous joint diseases, musculoskeletal disorder, and periarticular inflammation. Now, what is the benefit of Pentorse? It's an anti-inflammatory in action, fibrinolytic activity, it is chondroprotective agent. It also reverses the effect of osteoarthritis. This is the only drug which is available in the market which shows reversible effects of osteoarthritis. Inhibits the destructive enzymes and stimulate the hyaluronic acid secretion. Now, what are the contraindications? These are the most important things which should be taken care while using the drug. Pentorse being a plant-based origin, it doesn't have any side effect, but occasionally it will show hypersensitive, in hypersensitive patient, it may show some symptoms like MSS, diarrhea, lethargy, and anorexia. We also need to take precaution in following conditions, like if it is a septic arthritis, then we need to treat the dog with septic arthritis first. We need to correct that condition, and then this drug can be continued. Now, for septic arthritis, any form of antimicrobial treatment can be instigated. Then it cannot be used in advanced liver or kidney impairment or evidence of infection. If there is any such condition, this drug should not be given. Do not use in dogs with blood disorder. This already Dr. Vishwasrao has also shared that it should not be used in cases where there is coagulation disorders or bleeding or malignancy in dogs. Pentorse and polysulfate has an anticoagulant effect. So in the operative period, it should not be used. We should be given a gap of like 2 weeks before any operation or any surgery has to be performed. So do not use in skeletally immature dogs. Okay, dogs with long bone growth plates have not closed. So do not administer it in pregnant or lactating bitches because it crosses the placental barrier. Now, NSAID and in particular aspirin should not be used in combination with Pentorse as may affect thrombocyte adhesion and potentiate anticoagulant activity of the product. Corticosteroids have been shown to be antagonists to a number of action of Pentorse. So corticosteroids should not be given along with Pentorse. This is our suggestion, but there are many cases wherein doctors have got very good results when they are using corticosteroid along with the product. So it depends on case to case. It can be given, it cannot be given, but we recommend to not to be given. Now, what is the USP? It is completely safe and there are no side effects. Anti-inflammatory action helps in reducing the joint inflammation and pain. Chondroprotective action and inhibition of loss of proteoglycans helps in terminating further destruction of the joint and initiates regeneration of the damaged tissue. Stimulation of hyaluronic acid, as we have seen, increases the formation of synovial fluid, which helps in the lubrication of the joint. Technically, the product shows a long-term effect as compared to any other treatment options. Also, as you can see in most of the accidental cases, there are many cases wherein there are accidental cases. So definitely for accidental cases, we do have a product which everyone knows, which is Protect. It's a medical cover for pet. Definitely you can recommend whenever you come across many cases wherein there are accidental ones. So we are covering accidental cover in Protect. And last but not the least, this is a very new and very interesting thing that Vetina is bringing up new product into the market, which is wound closure devices. Vetina is partnering with Merrill. Merrill is in human wound closure devices, and now it is bringing veterinary devices also, veterinary wound closure devices. So very soon Vetina will be coming up with these products into the market. So stay tuned with us. Thank you. So we'll go ahead with the question and answers with Dr. Vishwasrao.
Sure.
Yes. So the first question is from Dr. Anupam. Is there a precise diagnosis for immune-mediated polyarthritis in dogs? What all blood parameters, synovial fluid are suggestive, diagnostic for the condition?
See, I have very rarely seen immune-mediated arthritis. Okay, it is very common in human beings, rheumatoid arthritis, but it's not very common in dogs. And particularly, I have had no experience with treating with an immune-mediated arthritis. The treatment will not vary much. Of course, the line of treatment will remain the same, but I think you will have to use drugs related to immune system more, because though this condition is very rare and I have not much experience. I'm sorry, I don't have much experience in treating immune-mediated arthritis because I've not seen it. But I think more or less the line of treatment will remain the same. and his question is the diagnosis. I think it'll be really very difficult to diagnose immune-mediated arthritis here, because what are the toolkits available that I think a pathologist will be able to tell you better rather than a surgeon. So I think line of treatment will remain the same, but test, I'm sorry, I don't know what test we will use for immune-mediated arthritis. I can always find out and we can email it to him. Okay, we can always go back. We'll do a research and email it to him. Please, we'll definitely answer your question with time. Give us some time.
Thank you, sir. Now, the next question is, how long NSAIDs can be given in case of osteoarthritis?
Yes, that's a very good question that always remains at the back of our mind. See, non-steroidal anti-inflammatory drugs have to be used very, very carefully. What happens in my opinion is, once you write down NSAID drugs, the pet starts feeling better and the owner continues to give without sometimes asking the vet also. So he feels, oh, like, my pet is feeling better, why not continue? So my advice is, first time when you give NSAIDs, clearly write on the prescription, depending on the severity, whether you want to give it for 5 days, 7 days, or whatever it is. And you need to evaluate. Say if the pain is very severe, you start from 3 days or 7 days. Call back the patient. Call back the patient. See how it is working. Whether there are any GI tract problems. Sometimes non-steroidal anti-inflammatory drugs will cause bleeding in the GI tract. So when we say how long, this question will vary from pet to pet, and most importantly, never write a general prescription for, say, a long time. You need to give a specific time, say 3 days, 5 days, 7 days, and after that you call back the patient, pet parent, tell them you get your dog back, let me evaluate whether you want to continue. At the same time, as I said, to cut down NSAIDs, we need to use chondroprotective drugs, say like chondroitin sulfate, glucosamine, because we want to reduce NSAIDs. And if we educate the owner that too much of NSAIDs are not good for your pet, then he himself will be reluctant to give. This is not only for NSAID, this is also for steroids. So you need to specifically write down how long you need to give and educate the owner regarding the side effects. So he's also not tempted to give. Especially prescriptions, give NSAIDs on a full stomach. If your dog is unwell, if the dog you feel is dehydrated or has some underlying kidney problem, you need to monitor. So tell them the potency of the drug, that to the pet parent, that see, this drug is a strong drug. Please don't use it without my prescription. Okay, that's very important. So 3 days, you start with 3 days, depending on the severity, depending on the age, depending upon, and meantime, you need to make a diagnosis of what it is. And all other therapies you need to start, because you cannot depend on NSAIDs for a long time, and you should not depend on long time.
Yes. Thank you, sir. Thank you for this answer. There's another question from Dr. Ashish Mane. What is the dose of glucosamine in case of osteoarthritis?
Yes, it's a very good question. Actually, it's very difficult to work out a dose. If you read books, there are a lot of doses given, and whatever is available in the market, these are all standards. So it's very difficult to, because these are basically, if you tell me these are basically like supplements, okay, and it's very difficult. I'm really sorry. It's very difficult to calculate dosages. It's really very difficult. There may be books giving it, but calculating dosage is very difficult. You have to start, and always, I always start with a small dose first, whatever I want to give. Start with a small dose, gradually go on increasing until you find you're getting effect. So in these supplements, I'm rather careful, and dosage really doesn't work for me. We start with a very small dosage, because these terms have to be given for a long time,
Yes.
So you've got to be careful.
Yes, thank you, Dr. Anupam. Thank you, Dr. Jinesh, Dr. Ashish, for the questions. The next question is from Dr. Dinesh. He has said, thank you, sir, for the nice presentation. His question is, how about denervation of hip joint for management of pain in coccytus?
Denervation, I have not done neither any books. See, we try as far as possible, try not to fiddle with nerves, not to play with nerves as surgeons.
Yeah.
Because if we try to denerve, then what would happen? It would result in paralysis. So we would compound the problem rather than solving it. So I think it won't be a good idea to denerve. See, basically, what happens is, he may be saying denerving because to reduce pain. I can understand. But pain can also be managed by many other things. As I said, physiotherapy you do. And most importantly, as I said in my lecture, is you involve the pet parent in the treatment. You do your technical part, but physiotherapy, massage, warm fomentation, if you involve the pet parent, what happens? He feels I've been involved in the line of treatment. And if the dog is in pain, he will do warm fomentation. Or if he's, so what happens is usually these procedures are compelled by the pet parent sometimes. Doctor, my dog is in a lot of pain, do something, do something. So what can be done at home is better than rather than doing something surgically in the clinic. Like denerving, I have not done it, and I don't think I would advise it to be done. But anyway, it's a good thought process. But I have not got any references also of denerving, especially for pain. I would rather prefer painkillers and some conservative therapy rather than surgically playing with the nerve.
Thank you, Dr. Dinesh, for the question. The next question is from Dr. Arun. Is rheumatoid arthritis common in dogs?
No. As I said, rheumatoid arthritis is very common in human beings. I have not come across any case where I personally have seen it. There could be case reports here and there, but in routine practice, no, it is not seen. In routine practice, it is very. I mean, in dogs, though, I have not seen. In dogs, though it's common in human beings, yes.
From Dr. S. Senthil, there's a question. What is the dose of LLT laser to be used for managing arthritis pain in dogs?
See, whenever these laser instruments come, you have a chart. You have a chart of the power, the intensity of this. So you will have to go by the manufacturer's this thing, because it's like intensity of light, the distance light. If you're using cold lasers, so whenever you buy these laser instruments for animals, first read the specifications of what they are providing you. Okay, what type, and accordingly you'll have to calculate the dose. It's like that. It will depend on the manufacturer's. Manufacturer will give you what it is, and the depth also. Yes.
Next question is from Dr. Sugan. What about the success rate of intra-articular PRP injection for the treatment of osteoarthritis?
PRP is what? Intra-articular PRP is what? Prednisolone. Is she talking about prednisolone?
Can you please, Dr. Sugan?
Is she talking about Pentorse?
No, it's not about Pentorse.
Intra-articular, she's saying.
Yeah.
See, let me understand what it is. Intra-articular injections do help. I have seen giving corticosteroids intra-articularly, especially in horses and all. They do work. In dogs, yes, they have been tried. They are work. They do work, but it requires a certain amount of skill to go with the
platelet-rich plasma. She is saying intra-articular platelet-rich plasma.
Yes, you have references, and they do work. They do work. Yes, there are some vets who have been doing this platelet-rich plasma. It's like, as I said, it's like taking out the own cells and introducing into the joint. So it's like introducing body's own cells into the joints to stimulate chondrocytes. So it's one of the same thing. But I have not come across any clinical research paper in which this has been tried, or a lot of cases which have been tried. So I really can't say about its success in clinical practice. I don't know.
Okay. So how do we differentiate birth weight, body weight, arthritis, and sprain or strain in dogs?
Sprain and arthritis.
Strain in dogs. Yes, arthritis.
See, basically, you have to do a complete orthopaedic clinical examination, because your fingers are your instruments. You need to move your fingers over the entire joint. Most important, as I said earlier, see the dog walk. Okay, see the dog walk outside your clinic, so you know whether the pain is in the joint, above the joint, below the joint, what exactly, whether it's a fracture. Because see, pain somewhere will all show almost similar symptoms. So first identify what limb it is, where it is when the dog is walking. So once you keep the dog on the table, then slowly palpate the joint where you feel, say, is the right forelimb or the red forelimb, whatever it is. Slowly palpate the joint and find out where is the tender motions. Okay. Now, very first day, you may not be able to differentiate between arthritis and, say, a strain or a sprain. But what you can do is you can find the tender point. Start treating the tender point symptomatically. Okay. with painkillers, with local physiotherapy. Observe it for 24-48 hours, call back the patient. Okay. Then you realize the pain has reduced, gone, decreased. So based on, because musculoskeletal diagnosis is never a one-shot diagnosis. You need to take steps. Sometimes you have to use diagnostic instruments. Now she asked me about sprain and strain. These are all soft tissues. Soft tissues will not come in the x-rays also. So what you require is a palpation, a thorough orthopedic examination, extension and flexion of the joint, okay, treating it and seeing the response to treatment. Many a time musculoskeletal system disorders are diagnosed by a response to treatment.
Okay. Is there any connection between slippery floor and development of hip dysplasia or arthritis in dogs?
Yes. Just to interrupt, my teacher, Dr. Jagdish sir, is there. Sir, good evening, sir. He was our dean, my teacher. So it's an honor for me that my teacher is there. So he's taught me. And sir, I have not been as good as you, but I have tried my best. So thank you for being with as a participant. Okay. Now, could you repeat your question, Seema, please? I'm so sorry.
The question is there any connection between slippery floor and development of hip dysplasia, arthritis in dogs?
See, hip dysplasia per se is a genetic disorder. It comes in the family. So people do correlate, because my floor is slipping, that's why my dog is developing hip dysplasia. But yes, hip dysplasia can aggravate if the floor is slippery because the dog doesn't get grip. Okay. So hip dysplasia is a genetic disorder. It can aggravate. Hip dysplasia is of 4 types, grade 1, grade 2, grade 3, grade 4. Pets can live with grade 1, grade 2. With grade 3 and grade 4, they have difficulty in walking, moving, etc. So if a dog has hip dysplasia, don't blame it on the floor. It's a genetic problem. It's the breed problem. Now, if you want to prevent further damage, yes, you can put rubber mattings. It will allow the dog to negotiate a rubber flooring better or a non-skid flooring better than tiles. But tiles, a smooth flooring will not cause hip dysplasia. Smooth flooring will aggravate hip dysplasia. Hip dysplasia is a genetic disorder.
Okay. So there are many questions coming up, sir. So
if there are many questions, what we can do is we can always answer them by email.
Yes.
So that you can pass on the questions to me.
Yes.
I'll see that I answer each and so that all our participants get the answer and they get a take home message of what they want, and we can clear their doubts. We will definitely clear their doubts.
Yes. So so now we had started with the quiz. One more question for the quiz, and then we'll have few more questions which will be answered by doctor. Okay. So the next question for the quiz. Is which animal never sleeps? Which animal never sleeps? Horse, fishes, horse.
We have a lot of answers coming.
Some people have written bullfrog. Yeah. Very interesting to know. Many people have written bullfrog. Initially, fishes, horse were written, but now it is bullfrog. Yes, the correct answer is bullfrog. The correct answer is bullfrog. Now, it's a very common question for all our vets. Normal adult dogs, how many teeth do they have? Normal adult dogs. 42. Yes, the correct answer is there, sir. Not a single incorrect answer. This shows the true veterinarians.
Of course.
Very, very grateful. Thank you so much for the wonderful answers. Most of them have given the correct answer. Thank you so much. Thank you so much for the correct answers. Yes. Now I'll take a few questions and then we'll pass these questions to Dr. Vishwasrao, and he will answer it through mail. Okay. So the next question is, not non-weight bearing exercise such as swimming in case of arthritic patients?
It is very good. It is very good. I mean, if you are lucky to have a swimming pool for dogs, I mean that's wonderful, because that's an exercise which will build up the muscles, and it doesn't produce stress on the joints. So in fact, swimming is a very good exercise. But of course, you need to train the dog first for swimming. You need to see how long it can tolerate. You need to go along with the dog. So swimming is a wonderful exercise, but you need to be along with the dog, because exercise tolerance also has to be taken into consideration. Yes, it's a very good exercise. It's a very good physiotherapy. It's a non-weight bearing exercise. Excellent.
Okay. What dog breeds are highly prone to arthritis?
Yeah, as I said earlier, if you see Labradors, Retrievers, you find hip dysplasia very common. So secondary arthritis is very common. Then Bernese Mountain Dogs, you have Rottweilers, they are very prone to arthritis. Then you have these miniature breeds like say Shih Tzus, Chihuahuas, these miniature breeds which have patella luxation problems like medial deviation of patella, lateral deviation of patella. So they develop secondary arthritis. And many a time security dogs which work on terrains, like high terrains and snow, or even mountain dogs which work on mountains. So working dogs, they are also very prone to arthritis. It's usually arthritis. Arthritis is a condition which develops in old age. So many of the dogs do develop, but most important what we have seen is uh, uh, the weight of the dog is very important. With the new feeding habits, like dogs go on eating a lot, we overfeed them many times. They have less exercise because we don't have time to take our dogs out. So increase in weight adds to the stress on the joints, and then we see in many breeds which are there in the house but which lacks exercise. So I would request all my veterinary friends that please request your pet parents to take dog out for the walk very often. Small short walks, very very important. Small limited physical exercise is very important from all points of view to maintain the health of the dog.
Yeah, this will be the last question. At what interval radiographic evaluation of hip is practiced by you while treating hip dysplasia?
Yeah, see, hip dysplasia first, normally we see signs between, say, around 4.5, 5 months of age. That is because the dog starts putting on weight, okay? And signs of hip dysplasia are variable. So we may take a first X-ray, say, at about 5 months or 6 months of age. But, hip dysplasia is a condition which keeps on changing until 18 months of age. A dog which is hip dysplastic at 6 months may be totally normal at 18 months, okay? So first, as soon as the owner or you find that a dog is hip dysplastic, take a radiograph. That will be the base radiograph. Preserve it in a computer or with the pet parent. And then a final radiograph you can do at 18 months of age. So 18 months of age is approximately when the entire growth of the dog is completed. And you know of where exactly of what grade the hip dysplasia is. Because until 18 months, normally we don't declare a dog hip dysplastic unless it is very severe, unless the family has it. So I think first radiograph when you see a dog, and next radiograph at 18 months should be sufficient enough. But in between, if you find it's getting worse, or the dog is unable to get up, or you find some other problems, compensatory mechanism like something for the lumbar spine is going on. Sometimes what happens, the dogs with hip dysplasia develop compensatory mechanism in the spine. So they stoop a little, they have a curve on the spine. So that is the time you need to take a radiograph early to find out whether there are any compensatory changes occurring in the spine also, lumbar spine. Please, yeah.
Yes. With this, I would request Mr. Vikas Anand has shared the email IDs. You can just share the questions with us. I will share these questions with Dr. Vishwasrao and he will directly answer your questions. So
Sure.
On behalf of entire team of Vetina, I sincerely thank Dr. Vishwasrao, who spent his busiest time gracing his presence for the webinar. Today, we had the opportunity to hear your thoughts, and this is definitely encouraging and motivating us for our future events. Thank you so much, sir.
Thank
I
you.
also thank all our wonderful participants for being a part of this webinar. And I also wish each and every veterinarian a happy World Veterinary Day. Thank you so much. And with this, I announce that the webinar is over. Thank you so much.
Thank you. Thank you so much, Dr. Seema. Thank you so much, Vishwasrao sir. And thank you so much to all the participants. It's such an overwhelming response we got it. So thank you. Thank you so much, everybody. Yeah.
Thank you.
Thank you so much.
Thank you so much, sir.
Have a nice evening, everyone. Thank you so much.
So much.